Okay, good evening. Thank you so much for joining us this evening. We have several panelists that will be providing information about their agencies. I'd like to thank our San Luis Obispo County Public Health Department and Dr. Bornstein, our Public Health Officer. She and I will be walking through the information this evening along with all of our guests representing multiple agencies throughout the county. I'm going to be introducing individual members and then asking them to give a very short 1 to 2 minute overview of where their agency stands at this point. We will be moving through a few housekeeping items. So if we can advance to the next slide. After the introductions, each agency will talk a little bit about the current COVID-19 situation within their agency. We will discuss childcare, schools, our universities. We have individuals from the government public school system as well as our private and parochial system on the line this evening. We will talk about some of the proactive actions to take that the community can do to help us as we move forward. We will respond to questions. And I would ask that as you are presenting your questions in the question box, if they're general questions, we will do our best to have them answered. If they are specific to a classroom, a grade, or an individual agency, please make sure your email address is included in the question, and we can make sure that that agency is able to respond to you directly. So for example, if you have a question about a science class at Cal Poly or a kindergarten class in Shandon, that would be most appropriate for that individual administrator to respond to you regarding those questions. So please include your email in those. It would be greatly appreciated. Okay, we're going to move forward and I will, the webinar participation. You can use the question and answer icon at the bottom of your control panel to ask questions. We will do our best to respond live and also put it in a text format. This webinar will be recorded and is being streamed live on YouTube currently. We also have plans to do some Spanish translation so that can get to other parts of the community as we move forward. I'd like to start off and introduce Dr. Penny Bornstein, our County Health Officer. I'm Jim Bruscia, your County Superintendent. Dr. Bornstein, would you like to make any opening comments before we introduce the panelists?
Good evening, everyone. I just want to say to our community that I know that today feels like another heavy day in this pandemic that has been going on for quite a few months. For those of you who haven't heard, and you will see in our slides, we've taken a step backwards as of today, along with many other counties. So I know that this likely has an emotional and a heavy impact on our constituents, as it does for us. We've been hopeful of moving forward. But with that said, we still want to provide all manner of information and support of how we can continue to strive for moving forward with our children getting back in school and us continuing to stay safe and healthy. So I look forward to this dialogue and thank you for having me.
Sheldon, if you could take the slide off and go back to the panelist screen, that would be appreciated. I'd like to first introduce Dr. Jeff Armstrong. He's the president of Cal Poly, and Dr. Armstrong had agreed to provide a brief update as to what is occurring at Cal Poly and the steps that they're taking. Dr. Armstrong.
Thank you, Superintendent Brescia and Dr. Bornstein. Appreciate this opportunity. As the majority of our students prepare to leave for Thanksgiving or fall break, I want to highlight some of the planning and what's been going on. We appreciate the collaboration with the city and the county. I distributed a video today, or will soon be distributed, where we're urging students to follow protocols, self-quarantine before traveling for Thanksgiving, and urge faculty, staff, and students to test between today and the middle of next week. We've continued to ramp up our testing between today and through the middle of next week we will be offering up to 10,000 tests for our faculty, staff, and students. To date, we've completed over 26,000 tests, and that's helped us to identify early cases. And early on, we believe it contributed to overall county positivity rate data, and coupled that with an aggressive quarantine in place program for students living on campus. While this had hundreds of students involved with this, it was proactive to limit the activity and to limit unintentionally spreading the virus. Our in-person classes have gone well with no issues, and we've only had 2 faculty staff test positive through our side of the ledger. This has allowed us to isolate students within hours of testing. And there has been a time in the past week, as you've seen from the media, where we used a local hotel. We're now in good shape, and we'll be adding additional isolation spots for the winter quarter. Before I speak briefly about the winter quarter, enforcement has been very strong in partnership with SLO PD. We've had over 260 cases that has gone to our student rights and responsibilities, with 56 of those involving off-campus gatherings. And so we have had some students suspended and asked to move off campus as well. So I'm proud of our students. The super majority of them have done a good job and have been very compliant, and some have not, and we've seen the impact of that over the last 2 weeks. Let me briefly talk about the winter quarter. Students who live on campus or have in-person classes will be required to provide a proof of a negative test within 3 to 7 days of returning January 3rd. All students living on campus or have a reason to be on campus, they will be tested at least once a week the first 2 weeks. Some groups will be tested twice a week. And we will strongly encourage those who are 100% virtual in the community to follow testing. And again, some groups will be tested more frequently. We're going to implement saliva testing on campus. This is a method that's been developed by our faculty. It's been validated, and we will be able to test 4,000 students a day when that is implemented in January. And we are also, we have validated wastewater testing. So it's clear this is still going to be with us for a while, but I really appreciate the partnership, particularly with Dr. Bornstein and many others in the county and the city. And while our plans will not unfold flawlessly, we know if we pursue them carefully, we can really maximize the good outcomes while minimizing the bad ones. So thank you for giving me an opportunity to provide hopefully a brief enough update.
Thank you, President Armstrong. We appreciate your time. We also have Dr. Jill Stearns, who is the President, Superintendent of Questa College, with us this evening. And Dr. Stearns, maybe you can provide a brief update as to where Questa is at this point in time.
Good evening. Thank you, Dr. Brescia. So similar to what Dr. Armstrong has shared, we have had protocols in place at Questa College and have been actively pursuing and ensuring that those on campus are engaged in following the protocols. I am on campus every day, and I see very, very strong compliance with all of the practices that we have in place. We anticipate our spring is going to look very much like our fall does. Roughly 8% of our total class schedule has some in-person component on campus. So it is a very quiet place most of the time, very few individuals on campus. Our athletic teams do continue to have their practices following a cohort model on campus, and we will continue that in the spring as well. Our competition is yet to be determined for spring.
Thank you, Dr. Stearns. In the North County, we have Tom Butler, who is the superintendent of Atascadero Unified School District. And Tom, you've had several of your, I believe you had some starting today. So can you please give us an update regarding Atascadero?
Yeah, sounds great, Dr. Brescia. I'm happy to. Yeah, I want to start by recognizing a very clear direction that was set by our Board of Trustees. It was a direction that valued parental choice and really prioritized the health and well-being of all of our students and staff as we began the reopening process. Through that, resulted in really 3 viable educational choices for parents in Atascadero that we're proud of, and those are in-person, distance learning, and of course our independent study program. Also a huge thank you to our staff, administrators, our Teachers Association, Classified School Employees Association for just a dedicated, deep commitment to thinking deeply about the health and safety mechanisms we would need in place to benefit our staff and students as we reopened. A big shout out to Public Health. Thanks so much for reviewing and consulting on our plan. That meant a lot, and we're really happy to have your expert advice on that. Update kind of with a timeline for you of some important dates in Atascadero. On October 5th, we were able to bring back in-person services for our high needs special education students. That was a great way to get started to really address some of their specific needs. Also on that date, on October 5th, we brought back high school athletics, and that was for conditioning and other appropriate extracurricular activities at the secondary level. On November 2nd, we opened up our traditional kindergarten classes through 2nd grade for in-person instruction. And also on that day, we brought back students that had defined needs at the secondary level for some additional support to that 6th through 12th grade. Today, we just reopened our 3rd through 5th grade, and we're happy to share that all of our elementary schools are now open for in-person. Maybe interesting for folks to know that the numbers for us, both elementary and our secondary parent registration survey, are right about 50% are choosing in-person or vice versa distance learning, and those numbers happen to work out well for us, and we're happy to be able to provide those choices. Also important to know that our Board of Education is formally approved January 5th, and that's our first day back after winter break, is when we would reopen our schools for 6th through 12th, and those are our secondary sites. Now we're mindful that we've moved into purple, and certainly our board will be having that discussion tomorrow, but that date and that formal approval still exists, and we'll be careful to monitor the situation as we come closer to that and keep our community informed. Thanks so much to all of our parents, our staff, just done such a great job following the protocols. I'm so impressed when I'm on our school sites. And I think it has now been proven that you can detect happiness and a big smile through a face covering. I'm proud to report that to everyone. If you have any questions in Atascadero Unified, please call me. I'm happy to talk to you directly. Have a great evening, everyone.
Thank you, Tom. Next, I'd like to introduce Dr. Kimberly Chang. She is responsible for 4 counties of our parochial schools, the Catholic school system, 4 of which of those campuses are in our county. Kimberly.
Thank you, Dr. Brescia. Good evening, everyone. We have 4 Catholic schools in San Luis Obispo County. 3 are either preschool through 8th grade or TK through 8th grade. And we have 1 high school in the county. All 4 schools together have a total enrollment of about 1,000 students. And currently, our schools are open for in-person learning. All preschools and grades TK through 8 are on site, and our high school is in the midst of their phased reopening plan, with freshmen on site last week and sophomores on site today. We also have a number of families participating in our remote learning options. Phased return was helpful for administration, staff, and faculty to implement all the health and safety protocols that we had planned on. I want to thank our principals, especially. They have the heavy lift on their sites, creating the plans, engaging the community, ensuring that it gets approved by public health. They've done a tremendous job. And our teachers and staff, they've done a wonderful job ensuring that our students are getting used to all the differences this year. We've seen how resilient our students are. And as Mr. Butler said, you can tell that they're smiling with their eyes. You can see it in their eyes. And it's been wonderful having them on campus. And our families have been wonderful to work with. We've had some growing pains as we've welcomed back students, particularly when we were determining what to do with students who exhibited symptoms that were related to COVID-19. This was particularly challenging when allergies were really bad and the smoke from the fires led to a lot of sore throats and coughs. But Dr. Bornstein's team was very helpful in going through each of those cases with us and determining when those students can come back to campus. But all in all, our school communities have remained healthy these past 10 weeks that we've been open. So thank you to Dr. Brescia and Dr. Bornstein for your leadership and direction and support as we maintain these healthy learning environments for all our students in San Luis Obispo County.
Thank you, Kimberly. I would next like to introduce Dr. Eric Prater. He's the superintendent for San Luis Coastal, our second largest school district in the county, and has a large number of the child care centers in operation currently. Dr. Prater.
Yes, thank you, Dr. Brescia. It's good to see everyone. I'm really happy to hear Mr. Butler's comment about smiling through the face masks. I have seen evidence of that, so I would concur. I just want to start by acknowledging how challenging this has been on so many levels. But through that, I also have to acknowledge how courageous and resilient our families have been, our employees, our students, and our school board. I've reached out to thousands of people through parent forums, much like all of you have, just through outreach efforts, and I think the common denominator is that virtually everyone that I've spoken with wants their children back in school in some capacity. What's hard, and it's hard to reconcile, is the unknown, and this business of COVID is filled with uncertainty and all the unknowns regarding the impact on individual people's health. Now, with that said, in San Luis Coastal, we have done many of the same things that I'm hearing our colleagues across the county have done. And I commend Dr. Brescia for trying to herd us cats all around together and stay in touch with us on a weekly basis as we try to figure this out. In San Luis Coastal, while we did make a commitment to close through the winter break, we have rolled out programs for our most needy students, especially our special needs students, our most intensive and less intensive students. And boy, it's absolutely heartwarming to see them on campus and to see them in school and doing what they love. And their sense of belonging is so important. And we started that beginning rollout program in September. And then in October, like many of us, we started athletic conditioning. I popped in and watched the Slow High football program running their small group cohorts. And I was just so impressed. Their ability to follow the health guidelines, the mandates, and do it with a smile, do it with energy and positivity. It was really impressive. The coaches, the athletic directors have done an absolutely phenomenal job trying to keep everyone safe. Additionally, this last month, in the beginning of November, we kicked off preschool and TK across our district, and they're just really doing a fantastic job. Additionally, this last week, we started a pilot kindergarten program, and that appeared at 3 of our schools, and that appears to be going quite well. And now what we've done is we're setting the stage actually for tomorrow evening at our board meeting to reopen in January. And that elementary to reopen beginning January 13th, and our secondary, our middle and high schools, to start on January 21st. And the reasons for that, January 13th, we're landing on because we figure the holiday travel and the potential of spread with that travel would give the 14-day window, which would mitigate some of the worry there. So we're starting our elementaries January 13th, pending board approval, of course. And then the secondary schools, middle and high, start their second semester January 21st. So we're all in alignment. So I'm really excited about that. There's a declaration period that our parents have right now between November 13th and November 30th. And that declaration, just like Mr. Butler had said, gives parents options. That's important to our board. It's important to our community that parents can choose between a distance learning program for their child, a virtual learning program, which is APEX, more of an independent study, and then in-person hybrid. We're pursuing an AM-PM hybrid. So half the students come in the morning, leave, and then half the students come in the afternoon. We're also working on a comprehensive childcare program that integrates, especially for our families that work. If you're in a PM cohort, you can receive childcare in the AM. So as a working parent, you can have your child supervised for a full day. So we're working on that as well. We're excited about our learning recovery and childcare plan. That's part of our resolution to be adopted tomorrow night. And that's sort of the proactive way of looking at how we're going to address learning loss and really get in front of it as best that we can beginning in January to make sure that the kids that we know are just really suffering have a chance to regain the lost time that they've experienced and to get them back on track. So for that, I'm really excited and I'm optimistic that we can whip this thing and get back on track. It's great to be here tonight, and thank you.
Thank you, Eric. Next, I'd like to introduce Paul Piet, who is the director and principal of Grizzly, which has remained in operation since the start of the pandemic, but looks very differently. So Paul, just a brief update for our viewers on Grizzly.
Thank you, Dr. Brescia. Hello, everybody. Grizzly Youth Academy, if you don't know, is a partnership between a Grizzly Challenge Charter School and the California National Guard. We are a residential educational program for students who are very at risk of dropping out of school. They typically have in their history a long history of non-attendance in their school. So a program like ours is not only essential, but in July when we started our program, 2 days before we started, and we bring in about 200 students each 5 month cycle we have. 2 days before we started, San Luis County went into red tier. And that forced all of us educational institutions to be in distance learning. So we brought our students in under the supervision of the National Guard. Again, it's a residential institution. So they came in, and Dr. Bornstein and her staff were vital to testing and helping us make sure that all of our students came in without a positive COVID test. Shortly after being in residence, we had a small outbreak. We had about 17 students test positive for COVID. But again, Dr. Bornstein's staff, herself and her staff, were able to lead us out of that outbreak without it spreading beyond that. So we were able to quarantine our students. We were able to snuff out the virus at that point. We, the educators, had to stay in a distance learning format while their students were in this residential setting. So now what we ended up doing is we put our students into our classrooms and our teachers taught from home. So the big challenge for us was we recruit students who have had lots of challenges in school. But what we were able to do with our partnership at the National Guard is we could bring our students into the classrooms and they could supervise and support them in the classrooms while our teachers could teach from home. I'm very happy to say that we are getting ready to graduate this current class at the end of this month. We are going to graduate them. And they have just shown a remarkable degree of resilience and flexibility and growth and maturity. And regardless of all of the challenges, like Dr. Prater was saying, regardless of all the challenges that this virus has brought to us, we're seeing some remarkable things in our students. Their ability to respond and grow in spite of is, it's quite inspirational, actually. So as this class gets ready to graduate, we will have a new set of students due to come in January. And we too will be bringing our reopening plan to our board on Thursday of this week in hopes that we are going to be in a status at the mid of January where we can reopen.
Thank you, Paul. Next, another North County superintendent that has had students in session for quite a while and has had some challenges but overcame them, Karen Grandoli from San Miguel School District.
Thank you, Dr. Brescia. Yes, we have had students on campus since early September. We started with our learning pods to support our neediest students, mostly students with disabilities, English language learners, and just other vulnerable students. Since the second week of September, we've had about 130 students on our 2 campuses. So if you're not familiar with San Miguel schools, we have one campus in the town of San Miguel. And on that campus, we also authorize a charter school, Almond Acres Charter Academy. Our second campus is at Heritage Ranch, and that's Cappy Culver. So as Dr. Brescia mentioned, we have had some road bumps. We have had 9 students and teachers over the last 4 weeks test positive for COVID-19. I look at it as sort of a challenge that we rose up to, and we learned a lot along the way. We worked very closely with public health to decide which cohorts to quarantine and who needed to stay home. We did a very, I think, good job mitigating the circumstances and keeping the virus contained to single cohorts. So that, I think, although it was a bit of a setback and it did cause us to push our reopening date back slightly at Lillian Larson Elementary School, we did actually open our hybrid reopening today. We started with TK through 3rd grade up at Cappy Culver, and at Lillian Larson, we started just TK and kindergarten. Our 4th through 8th graders will be starting at Cappy right after Thanksgiving break. We will start our 2nd and 3rd graders, 1st through 3rd grade right after Thanksgiving at Lillian Larson. We will then start our 4th and 5th graders at on December 7th, and then we will wait until after the winter break to bring back our middle school at Lillian Larson in January. Unlike some of the larger districts, our middle school at Lillian Larson is on the same campus as our elementary school, so we are hoping that we can continue with the reopening in January with our middle school. Wanted to mention that I think through this whole process, the most valuable information I've been able to gain is working as a team with the county superintendents, with Dr. Brescia, all the people you see on this call, and all of the people who aren't here tonight, and with public health. We have learned a lot along the way, and I'm confident that we're going to be able to move forward with a successful reopening. So thank you.
Thank you, Karen. And our last superintendent that's joining us today, Dr. Kurt DeBoost, representing Paso Robles, our 3rd largest school district in the county that has also had in-person services starting recently.
Thank you, Jim. I'm Dr. Kurt DeBoost, superintendent of the Paso Robles Joint Union School District. I'm not going to say a lot because most of what I have to say has already been said by Tom, Eric, Karen, and others. We started back the small cohorts for special ed and other special needs kids back in early October. We started TK and K November 2nd. About the only thing we learned from the first day there was we had too many support staff probably that complicated things further than needed to be. And we've kind of ramped that back a little bit. But echo the comments about how excited the kids are, how thrilled the teachers are to have the kids back, and just an awful lot of joy from that. 1-2 reopens tomorrow in our schedule for elementary hybrid. Monday is a conference, continued distance learning day, and Tuesday through Friday are in-person days. So we start back tomorrow with 1-2 and 3-5 on November 30th. Our approved plan with our collective bargaining agreements and with our board was to start back with secondary January 5th. Like Eric, I'm going to be making a recommendation to the board that we delay that for 4 days and take 4 days that we have scattered through the second semester for non-student days, non-instructional days, and put those into that first 4 days as non-instructional days and preserve the instructional days for later when hopefully we can be more certain of being back to in-person learning. So we hope that there will be a path forward, either through being back in the red or some other avenue through which we can get as many of our kids back as possible safely in January. Sports have started with conditioning. I know that the athletes are really looking forward to those competitions that have been scheduled for January. It's been a long, long, difficult year. Part of the challenge that I've faced, I think, is that parents want to make intelligent, best decisions that they can, and they want specifics. And yet we're caught in a bit of a conundrum because in order to provide the statistics, we need the answers from them of which option they're going for to make sure that we can staff them accurately. And so it's been awkward at times to say so many times to parents, it depends, it depends, it depends. And a lot of people wanted more closure and definitive answers than that. I would really like to express my personal and professional gratitude to Dr. Bornstein for her patience with Paso Robles through all of this, and the professionalism of her entire staff and how quick they've been in their responses. And Dr. Brescia, thank you for your leadership on this as well. So not a whole lot else to offer. Disappointing news today, but I hope we'll rally around and comply with all the guidance and bring us back to work and bring those kids back in January so that the seniors in particular can enjoy at least half of their senior year. Thank you.
Thank you, Kurt. There are two other individuals that will be on the webinar this evening to assist. Amber Gallagher, who is the Executive Director for our Special Education Local Area Plan. So all of our services with special education throughout the county in one way or another filter through Amber's office. And Chelsea Olson Murphy, who is a local counsel for the superintendent's group, is also available this evening to respond to questions and to help. I did have some brief information from our other school districts that they were not able to attend this evening because of local meetings they had, and they are all moving forward with one level of service or another. So tonight you have multiple agencies, school districts, charters, our colleges, childcare centers, private and parochial schools here to try and respond to questions. The information is as current as it is tonight. Everything is consistently changing, and I think we need to remember the three things: to be flexible, to be patient, and to be kind with each other. So at this point, I'd like to turn the conversation over to Dr. Bornstein to give you some updates, and I believe, Sheldon, you can start that next slide now.
Yeah, so again, good evening. What I'm going to do in the next few slides is just walk you through some data, just so you can be reminded of where we've been and where we are and where we're heading. So this slide just gives you a sense of the number of cases of positive people who have tested positive for the virus since the very beginning in March. You can see through March, April, May, we were quite low. And then we, along with the rest of California and some other areas of the country and the world, experienced a peak in the July, August timeframe. If you see national charts, you actually will see a peak in April that we never experienced, but we did have that July, August peak. And then we took additional actions, both at the decision of our county as well as state actions, and we were able to bring our caseload down pretty much almost in half. And we were very stable through September and October. We started to see at the end of October an increase, and here you can see halfway through November, we sit at 940 cases. And if we were to remain on that trajectory for the entire month, we'd be well above where our highest peaks have been. So with the next slide, and Sheldon, yeah, okay, so I'm going to have you advance them. Thanks. So this just is a similar curve, but it is focused more on the more recent months, and it shows you where we are in our daily uptick since the beginning of this month. We were very stable September, October, and November has been a very steep increase. And this is what we're seeing across the state and the nation as well. So with the next slide, this is similar to the slide I just showed you, but this is specific to the period of time that the blueprint went into place, where there are 3 metrics that have been looked at by the state to determine what tier a county is in. And our county started out in purple that very first week with a case rate above 7 cases per 100,000 per our population. So if you do the math, 7 per day times roughly 2.8 100,000s of population, we need to stay below 20 cases a day. But this is that case rate, which means we need to stay below 7 per 100,000. So through, again, September, October, we were doing very well. We almost got to the orange tier. If you look at 1027, 3.9 would have put us in orange. For a couple of weeks, we thought we were going in a very good direction. And then as you know, things have taken a turn for the worse in the month of November. And where we stand today at 12.5 is the highest case rate we've had. And that, along with 41 of 40 other counties in the state of California, has landed us all in the most restrictive tier, effective tomorrow. So the next slide. This is one of the both other metrics that determine a county's tier are pictured on this one slide. The blue line that starts in the beginning of September at 4.6 and now has us back up at 5.1. That is the entire county, the positivity rate. And what that refers to is, of all the tests done for COVID in our county in that particular week, how many of them, what % of them have been positive. So again, through much of September, October, we were very stable, and now we're seeing that go up. The other metric that got added in the beginning of October was to ensure that we weren't just doing well as a whole county, but leaving certain populations behind. So the nature of this metric is to look at the positivity rate in those census tract areas of our county that are more vulnerable by virtue of income and housing and access to health care, education level, a whole host of different dynamics that go into determining which geographic areas of our county are more vulnerable. The positivity rate in those census tracts is collectively measured and has been relatively stable and consistent with the county as a whole, except for last week where that started to diverge again a fair bit. And this week, the state has determined to not even look at that metric because because most of the counties in the state of California have moved backwards just on the basis of case rate. So we're missing that final data point for that metric. So the next slide breaks it down by age. So we have consistently looked at what the distribution across the age spectrum is of our cases since the beginning. We have just over 5,200 cases as of today. And we know that about half of them have been in the population that are under the age of 30. That is a change in recent months. It is reflective of the outbreaks that we know are occurring in the Cal Poly community, but it is not only Cal Poly, and it is consistent with people moving more about the community in different ways and having gatherings and parties, and particularly younger individuals have a harder time understanding that as they go with this disease, it potentially presents risk to older family members, neighbors, those who we're working with. So we've been trying to message hard to the younger population to really take this disease seriously and try to keep themselves and everyone else out of harm's way. But as you can see, the other half of the population that have been impacted by this disease are above the age of 30. Of course, it decreases with each age cohort, with our, above 85 being the least impacted, and that's undoubtedly because they have taken the greatest precautions. So the next slide. This just shows you we've, in the last couple of weeks, we've made this available on our website so that people at a glance can always see where we are with those 3 metrics in the gray, but just even more so at a glance where we are in terms of which tier, and with that tier assignment comes determinations of what different business sectors as well as the school can do under the state's blueprint for a safer economy. So we reside in purple, and so what does that purple mean in the school sector? So for those schools that have begun their reopening process prior to today without a waiver, just simply when we resided in the red tier for more than 2 weeks, which we have now for a number of weeks, schools developed their reopening plans. They revised plans from earlier in the summer. They resubmitted them to public health, not for approval, but just for consultation and feedback to make sure that everything was in accordance with the best practice rules. And many schools have been able to move forward in that regard, both in the private sector and to some extent, as you've heard, in the public sector. Many other schools are in various phases of plans to reopen, but those who have not yet reopened at this time cannot do so fully. But as the next slide, I believe, shows, is absolutely elementary school level at any school district can still open for in-person instruction, as many did even while we were in purple at the very beginning. We received, especially in the private sector, a number of waiver applications for reopening at the elementary school level, regardless of our tier. Again, these plans are quite similar to the reopening plans. The one distinction is that public health actually receives applications, reviews them, approves them, and shares them with the state health department. But they are very much based on the same underlying best practice and scientific data, guidance and data. It is available only for kindergarten through 6th grade. So those campuses that have, even on their same campus, but if they haven't reopened at all, they can apply for the waiver for K through 6. But at this moment in time, grade 7 and above would not be able to open. So the next slide. So what are we seeing with respect to schools and children? For the most part, we continue to see that children of all ages, teens as well, and even young adults are doing quite well when they do get this disease. There are uncommon cases where the disease does wreak havoc, or even there have been fatalities in the younger age groups in the United States and in California. There have been some complications that children have experienced, and some more severe disease. And so we don't recommend, as some have thought, well, let's just get all the kids infected and then they'll be done with this and we can move on. It is still taking a bit of a chance, so we don't like to see children infected, but the good news is that when they are, they have much less severe disease, and the vast majority do well with this disease. The younger children, sorry if I can go back a bit, the younger children do better in terms of not being able to spread it as readily, probably partially because their coughs are not as robust. There's not as much air produced, but older children do seem to transmit much like adults. And again, especially vulnerable children, I said some children do bad. That is especially true with those who have underlying conditions like asthma or diabetes or heart disease. And the most common symptoms in this age group are fever and cough. But we have shown that, through this, amongst you heard that there are thousands of students that are in school. We have had very little in the way of cases in schools, and with maybe one exception, virtually no outbreaks. So things are going well in our school environment. Next slide. So what are, this may be obvious to many, but I think it bears looking at the benefits of in-person instruction. Easier access to the school services, it's more efficient, social interaction is very important for our students, and you know, anyone who is listening to this as a parent or a family member knows that being able to do what you need to do in life in terms of work is made that much more difficult when students have to be at home. So we very much want to support getting students back to school so that parents and caregivers can also do what they need to do in life and work. The risks, of course, are, you know, that when you bring a number of people together, there's absolutely higher risk of exposure and transmission. And then, you know, the concern of those students who may have a very mild course or no symptoms at all, potentially bringing it home to household members. And also, as staff are of varying ages, they may have higher risk of exposure as well, faculty and staff. So the next slide, oops, I think we missed one. So what actions can schools take is, and this has been played out in the schools that are open, daily health checks, sending anyone home with symptoms, requiring masks. And this I want to highlight because there was a lot of thought at the beginning that children would have a hard time with masks. I can tell you unequivocally that children do much better with masks than adults. I have heard from all the schools that are open, they hardly notice, they go about their business, and this is even amongst the younger age groups. So 3rd grade and above, it's required, but it's strongly recommended for younger ages. And those younger children, preschool, kindergarten, are doing pretty well with masks. And keeping distance is also one of the most important protections that we can take. The schools are doing a good job by maintaining their cohorts or smaller groups, whether it's through school instruction or hybrid instruction or just through the cohort process, their enhanced cleaning and increased ventilation. And we are so blessed to live in a county where through much of the year we can allow outside air or outside activities. Next slide. So what can parents do to support safe in-person instruction is teach your children how to correctly wear a mask, participate in those morning health checks, have family members tested when anyone appears to have symptoms of COVID, keep children home when they're sick. The child needs to stay home if they have been in close contact with someone who is infected. That's our quarantine process. Parents and family members get a letter if they're ordered to quarantine by public health. Stick to very small groups, the state and health, the gathering guidance, and we've been saying this even before the state came out with that guidance. Stick to no more than 2 other family units and do so for a period of a minimum of 3 weeks before you change who you socialize. And then in general, keeping up with vaccines and flu vaccines or other things so that we can minimize other diseases which could be confused with COVID. Next. Additional actions parents can take, teach home hand washing at home, have daily routines so that we're protecting our children's health, but also their mental health does better when you've got these daily routines. Talk to children about the precautions and why they need to take them. And within family units, figure out how you're going to keep your most vulnerable household members safe. have emergency contact available, especially for the schools, so they know who to contact if a student does need to go home, and keep in touch with your school and what's going on. So I did mention the social emotional well-being of students. This is critical. I know it in my own family. We know it from many people who are engaged in the response, as well as all of you, that these are not normal times. And the more we can talk about it and provide support and comfort to each other and destigmatize, for those who have gotten COVID, stay engaged, attend meetings, and find ways to take care of yourselves through outdoor activity, exercise, good sleep, etc. Those are all important things for us to watch out for.
Thank you, Dr. Bornstein. Sheldon, you can take the slides off. I see one of the first questions in the box here was really about what are some other school districts doing throughout California. I'll just speak briefly on that, and then I know a couple of our colleagues and Dr. Bornstein can add more. From a big picture standpoint, there are different options being offered across the state, from rotating days to AM, PM cohorts to week on, week off cohorts. Kimberly, you have 4 counties that you represent. Are all of your schools basically in session, or have they varied? I think we lost you there.
Can you hear me now?
Yes, go ahead, please.
Yeah. All our schools have been open to in-person instruction, except for the secondary schools in Monterey County. The 4 counties in the Diocese of Monterey are Monterey, San Benito, Santa Cruz, and San Luis Obispo. So the other counties were in red, so all schools had been open to in-person instruction.
Thank you. And Eric, you have quite a few contacts in the Bay Area, and I know with your city school superintendents. Were there some other varying models that you saw?
Yeah, I actually borrowed one of the models for consideration, and that is heavily dependent on the number of families that choose to remain in distance learning. So if you can get those numbers for in-person down at the secondary level, one of the ways that I've seen, this is actually Santa Cruz City Schools, that it caught my attention, is that they have Monday through Friday AM sessions for everybody. And then in the afternoon, the same teacher teaches those that are in distance learning, so virtually. So it's a hybrid of in-person and virtual with the same teachers. And so what that does is that that has a collective impact on disruption. So it allows students to keep the same teachers they had before, or at least keep that as a strong likelihood. And it minimizes the number of transitions between the AM group and the PM group. So it's safer. It allows teachers a little bit of blended learning and teaching, if you will. And for the kids that are there in person in the morning, if they're struggling with something, they can get a double dip in the afternoon virtually. So it sort of has an interesting model. That's one thing I saw. I've also witnessed some AABB, so Monday, Tuesday, Group A, Wednesday, cleaning day and teacher prep, and then Thursday, Friday, Group B. And those staggered models, alternate day models, are intriguing and I can see the benefit. But at the end of the day, for us, we landed on the AM PM simply because it's more consistent, more eyes on kids every day. So if a child that's off the tracks misses a day in an alternate day model, it's missing 2 days of school. So it's a pretty slippery slope for our more at-risk kids. So that's what I've seen at this point.
Thank you, Eric. The next question I'm seeing is directed more at Dr. Bornstein, and it's basically saying that we closed with far fewer cases. Now we've determined that it's moving forward. Why would we have determined it would be safe to open with the declining situation? So maybe you could kind of update on the change there from early on till today.
Yeah, I think there was very dramatic action taken in March because there was so much more unknown and misunderstood about this disease. So now 8, 9 months, 10 months later, we have a lot more information about asymptomatic spread, about how it impacts different populations, about underlying disease, about how much more the healthcare community understands how to take care of people infected, and mask wearing. You know, I'll be the first to say that I was kind of late to adopt, you know, that the universality of mask wearing in all situations. That has evolved considerably over time as our best tool for preventing transmission. And so with all of that additional information, and the amount of time that has passed, we very much want to find ways to, as I call it, coexist with this virus. So where we can put into place protective measures and still not, you know, harm our population either economically, social, emotionally, developmentally, we're going to try to do everything we can to support some measure of business as usual, because it is, you know, not the only thing that impacts our health.
Thank you. There was another question previously, and I think we answered it, but to restate again, since I see it several times, if a campus, a physical school building has started to move forward, they can continue to move forward, you know, pending any more changes from public health. And the way I'm understanding this, let's say you have school campus A, if that has grades kindergarten through 5th or kindergarten through 8th, if they had a plan to move forward, they can continue phasing up. However, if take San Miguel, for example, that has the same grades at 2 different campuses, if one campus hadn't started, they need to stay put. And is that correct, Dr. Bornstein?
Yes. So, sorry, I'm trying to manage answering questions on chat as well as here. So yes, for a school that has begun the process of reopening, even if it's just 1 grade, they can proceed through the grade levels according to their plan with reopening and all the protective measures in their plan.
Thank you. The next question I see is more specific to North County and Paso Robles, and it talks about with the largest number of cases. I think San Luis has a few more if you count Cal Poly, but Paso Robles has the largest number. Even if we're approved, is it in the best interest to continue moving forward? So I would open that up to either the North County school districts or Dr. Bornstein on that one. Did either Kurt or Karen or Tom want to take a stab at that, or? Kurt, go ahead.
I would just say that we will follow the guidance of Dr. Bornstein and the County Health Department. I'm not the expert in this. The experts will tell us what the guidance is, and we will follow it. To not do so invites exposure either way. So we will just, with fidelity, follow whatever guidance comes from the people in charge of this.
Thank you. Anything else you'd like to add, Dr. Bornstein?
No, I think, you know, the data that we keep our eyes on are outbreaks, age-specific circumstances changing related to youth, impacts on broader community. And I have consistently through this indicated that for a variety of reasons, if we can open our school safely, we should do so.
The next question was on testing, and the question was asked about students offered testing. I know that at both of our higher education agencies, Questa College and Cal Poly, the students are offered testing, and then also at Grizzly Youth Academy. But at this point, I'm not aware of students being tested by the agencies other than public health. Dr. Bornstein, anything on that?
I'm sorry, repeat that.
Just in terms of the testing right now, all agencies are testing employees. Grizzly has tested students because they're in residential, as well as Juvenile Hall is testing students. And I believe that Cal Poly and to some extent Questa are testing students. But within the broader K-12 community, other than public health or private providers, I'm not aware of any large-scale testing for students.
Yeah, that is true. I think there are some that are recommending, but no, that isn't part of the plans of any of the school districts.
Okay, thank you. I'm going down the questions right here. There was a couple asking for clarification on runny noses and coughs and other things. Maybe one of the school districts that's had that could comment, because we are having to triage a bit here, but sometimes on the level of caution. Karen, I know that you've Tom, go ahead. Your mic came off.
Sure, I'll jump in on this one. I just want to thank our community. I know we've got a lot of parents in the audience today, and really that commitment to monitoring your children's health at home and keeping them at home right now if they're not feeling well. Ultimately, then you can check their symptoms, see if they recover, or you can go and, of course, see your healthcare provider and get tested if you feel that. But that type of proactive approach is going to help us keep schools open. And it's that type of partnership that we really need right now. And it's going to benefit everybody. So compliments to the parents, and pass the word that, be cautious here. We can move your students right over into distance learning. There's no break in their educational program. And we really encourage parents to take that time, keep their students home until they're feeling better or they've seen their healthcare provider.
Did either of our post-secondary colleagues want to comment on that, Dr. Stearns or President Armstrong?
So I would say that we are working with county public health, and the testing that we are requiring is around our high risk activities, which include our athletic teams and include some of our performing arts, particularly voice. And so we are not doing just sentinel testing of all students that come to campus, but much as Tom just shared, we really are encouraging, if someone is not feeling well, please don't come to campus. If you have a fever, please don't come to campus. And we are hearing daily from our faculty around how students are communicating and really holding themselves accountable for monitoring how they're feeling and using what we call our daily 3-step check.
Thank you. Dr. Armstrong.
Yes. Before the recent uptick, we were sampling quite a few asymptomatic students, and the rate was well below 1%. And then we were sampling more frequently with students, not because we were condoning any risky behavior, but because they have risky behavior and they're more active, the Greek community. And then because of that, looking at social media, we were able to pick up. We will be returning to basketball. Again, if Dr. Bornstein and the state continue to allow it later this year, and the NCAA requirement is 1 PCR per week, and we'll do 2 PCR per week for the players and anyone in close contact. And in the winter quarter, we're going to sample any student on campus at least once a week. And again, if we need to, we'll sample really with PCR twice a week is about as frequent as you, I think, need to go. And we'll have some groups that will be at twice a week, and then it'll depend on prevalence. And the saliva test will help us move that along, but our campus health and wellbeing lab will continue the swab PCR test.
Thank you. The next question I have right here is regarding a couple of the districts that aren't on, but it's a general question here specific to Lucia Mar. If the school districts that did not start large scale still have the option for a waiver at this point, again, subject to change if things come from the governor's office or state public health. So just for elementary campuses, again, my understanding is that they may continue to move forward with the waiver process with public health for approval. And as of this afternoon, that hasn't changed, correct, Dr. Bornstein?
That is correct.
Okay. There was another question here, and you may have answered it already, on the masks. The question was about the mandate versus the recommended. But I also wanted to start off with the positive, and Kimberly, you're seeing across all 4 counties that students are not having a difficulty with the mask, correct?
Correct. They've actually been very compliant. We had some growing pains. Some of our littlest ones chewed through the first few disposable masks, so we knew we just had to have extra ones on campus for them. But for the most part, they've been doing a wonderful job, and we've had students say sometimes they even forget that they're wearing them, and so it was a learning curve at the beginning, but they've really adapted to the call to wear the mask.
And Amber, across the county with our special education students, we're seeing fairly high levels of positive participation with masks as well. Anything you'd like to comment on that, what you're seeing across the county with our SPED students?
I would just say I echo what Kimberly said in terms of our students responding actually very well with being able to tolerate wearing masks throughout the course of their time for in-person services. And for those who are struggling, working collaboratively with our families in creating those expectations for our students, practicing, providing social stories, all of those sort of narrative scripts to help students understand the why behind the need to wear a mask when they come to school, and that kind of change in expectation from what they had been previously used to. But in general, seeing very positive responses from our students with disabilities.
And as far as the face coverings go, Dr. Bornstein, the question was specifically about a difference with state versus local on that one. I'm not aware of that. You've been pretty consistent in the last few weeks about everyone should have one on, students and staff. Could you maybe clarify that? Is there a difference between state and local on the mask ordinance?
No, there is not. We've been following the state mandate on the face masks. That is expected to be changed imminently. What we're expecting to see from the state is, rather than these are the conditions for which a mask must be worn, is and this is for the entire community, not just schools, is a policy that's based on exception. So these are the only circumstances in which a mask doesn't have to be utilized.
Thank you. The next question I'm reading here is about if the person has a family member who's diabetic working for a school district. So I guess this would be employees. And what is your medical opinion on those if they are employees and having direct interaction with students, if they have a medical condition? I mean, I know we're all going through the workplace modifications and accommodations for that, but your recommendation if someone has a medical issue, Dr. Bornstein, if they're going to be working directly with students?
Yeah, so I think the question was actually not so much the teacher or the staff member themselves having that medical condition, because that faculty member or staff member should work with their school district for any kind of accommodation if they themselves are at risk. The question is, should I be concerned about going to my place of work if I come home to someone who's got a higher risk? Those questions really need to be answered both at the individual, level, the family consideration, and in process with the employer. What we are not seeing at this moment in time, really any transmission to school staff, but if case rates were to get higher, that certainly is a possibility, and individuals would have to make that decision about what type of risk they're willing to have in their individual families.
The next question I'm reading here was on mental health with students, and maybe we could have a comment from one of our school districts on that. I know we have counselors across the county, and then I'm also seeing the same thing provided by both of our higher ed partners. So Eric, I know you have quite a few therapists and counselors across the county, not only in person, but virtually.
Yeah, this is such a important piece because we know that isolation and so a lack of social interactions other than on a screen is causing some real problems with kids, and so we actually brought on a social emotional learning counselor into our district level to then through student services. And so what we're doing is we're trying to coordinate our response with our school site counselors, working with teachers who are working with kids each day, and trying to determine how to best provide those supports. For those more serious situations, we have worked with Transitions Mental Health to work on marriage family therapists and marriage family therapist interns. And you get a lot of bang for your buck that way. And so through those contracts, we're able to do some more direct intervention, especially through the social emotional interventions. And we're finding the need to be fairly extensive. And we're thankful we built that part in.
And I know both at Questa and Cal Poly, you have upticked your socio-emotional support, not only for students, but for our individuals that work with you as well. Would either Dr. Stearns or President Armstrong want to comment on that?
Yes, over the past few years, due to interacting with the students and them participating in a fee increase, we have increased our medical and mental all aspects of health and well-being, including mental health counseling. So that has helped us as that was scaling up. And then we are also doing a lot of telemedicine as well as counseling that still, poses some, difficulty. We also moved to all single rooms. That adds a bit of additional isolation and stress. Living in a double or a triple, while it can be challenging, students also find that invigorating and stimulating. And so there's a whole range of issues, and I'm really proud of what our work in student affairs is done, led by Vice President Keith Humphrey. So there's a lot more, but I'll just keep it brief.
Thank you. Dr. Stearns.
So similar to what Cal Poly has done, we have also pursued increasing significantly the mental health services that we're able to provide on campus. And we have several grants that have allowed us to build that out. And we have a partnership with Cal Poly where there are students that are part of our mental health team, and we appreciate that very much. But yes, lots of need at this particular point in time, lots of basic needs being expressed by our students, housing insecure, food insecure, And the prolonged pandemic is certainly having an impact on the mental well-being of the campus.
And there was a question there about local numbers on mental health. I've been on calls with providers, but the majority of the information is anecdotal at this point. Dr. Bornstein, I'm not aware of any hard numbers regarding our county. However, the same things I'm hearing from my colleagues is we're all sensing it and seeing that, but I couldn't quote stats for you.
Yeah, I have tried to get some of this information from our behavioral health department. The data is mixed. We have not seen an uptick in suicides. We have seen an uptick in calls to the hotline. Those are primarily from adults. I don't have really good information on how this may be impacting youth. Our behavioral health department has seen more demand on their services, and because of some of the ways they're operating, they are not able to quite keep up as well as they did pre-pandemic. But in terms of really hard numbers on the diagnoses or even calls for help in the youth population is not readily available.
Thank you. The next question is about would sixth grader. So the sixth graders, which category do they fall into? 11, 12 years old? Are we looking just at grade level or ages? So the question actually says, would sixth graders spread the disease like an adult or more like young children? Which category do they fall into age group?
So I can take that one. So though an imperfect system, sixth graders fall into the elementary school grade level that is allowed to open for in-person instruction with a waiver. The medical literature on what age beneath which the risk of transmission or risk of disease severity is lower is, there have been various studies. 10-year-olds, 12-year-olds have been in the mix. And so just for ease of policy making, the state has made the decision that all elementary school grades up through sixth are treated the same way in terms of in-person instruction.
Thank you. A couple of questions. Sheldon just pointed out to me that tips for grandparents that are caregivers right now. Any suggestions or recommendations that grandparents are being caregivers for their children?
Well, it somewhat depends on the age of the grandparents and medical condition. And certainly anyone who has underlying medical conditions, heart disease, lung disease, kidney disease, immunocompromised, cancer, et cetera, should make those kinds of challenging family decisions about the allowance for their children and how they move about the community, again, because they are probably not at high risk for bad outcomes, but should they become infected and bring the infection home, obviously through symptoms, or even not obviously, if they don't have symptoms, that could have a significant health implication to family members like grandparents. So it's certainly worth a family discussion and some thoughts about, are there other ways that we can keep grandparents or elderly relatives or those with medical conditions safer if other members of the family, like the children, are, whether they're going to school or going to parties or going to play dates, all of those considerations need to be taken into account.
Thank you. There were a couple questions about the metrics or the triggers to scale back the programs that are doing in person currently. Could you just refresh us on those, please?
So the general guidance on when a school or district should consider closing based on cases or outbreaks in the school setting is that if 5% of the school population, including students and staff, have tested positive, that would be a marker for considering closing of a school. If more than 25% of all schools in a district have had to close, that might be the decision point for closing a district. Additionally, though there's no hard number, if there are a number of outbreaks in a school, but even if it's less than the 5% population, but it's all happening very quickly, that also might be a reason to pause in-person instruction for a period until that until those outbreaks have been resolved.
Thank you. I'm seeing a couple more questions here that maybe some of the K-12 superintendents could respond to in terms of notification. When there is an issue, what I've observed is that the school agencies are notifying all of those students and or staff that have a direct contact, and that is in addition to some of the notification coming from public health. So would either of the superintendents like to take that one where you've had to notify not only employees but families as well?
Yeah, sure, Dr. Russia. I'm glad you mentioned we have our general, infectious disease notification that would be for the campus. And then if it's isolated to a specific classroom and that classroom needs to move to distance learning, we have a notification for that. Working with our nursing staff, which works in collaboration with public health, if there's different levels of contact and different levels of, household possible connections, we're being able to process that through the contact tracing and then notify people correctly. And so in addition to ultimately, if we ever did get to the point where we didn't need to close the school site, we have those type of letters ready as well. I think Dr. Bornstein could probably add on to that.
Yeah, what I would want to say about this in relation to the last question as well, these markers of when to take action are just that. They're indicators that perhaps this is the next course of action, but they're not mandates and they're not an absolute rule book. So as I've said to the superintendents in many of the discussions that we've had together, and I say this to the families as well, is we're not going to go by an absolute guidebook that if you hit 26 cases, you close. If you hit 25, you don't. A lot will depend on what's happening in the community in that particular geographic area, how spread across the grades the cases may be. So it's an iterative process, and I know that that Karen Grandoli, we had that process where a lot is taken into account. What's the situation for the particular students in a particular school? If they were to have to stay at home, is that a more safe or a less safe option for them? So, all of these kinds of questions would come to bear on the decisions, but very much with information and transparency at the forefront for families.
There's a question in the box that regarding sort of education as schools return to in-person, what sort of outreach can be done to help educate families on the need to practice safety, and what resources, if any, are offered to families so that they don't feel they need to send their children to school sick. So I will let any of the districts or higher ed offer that, because I've seen it with whether we're dealing with adults or children, people showing up. I know myself, I've been very assertive that if you're not feeling well, go home, where we may not have done that a year ago. So anyone else want to comment on that one?
Well, I can comment. We have had a lot of kids coming on campus for cohorts. We are screening them as they enter campus, and sometimes they sneak by. They don't have a fever. They come into the classroom, and then the paraeducator or teacher in charge of that group hears a cough. Right now, we're erring on the side of caution. The child will be immediately sent to the office. We call home, and we send the child home. Of course, there are times when it's allergies or asthma. It's great if parents can be proactive and give us those type of notes so we can get their health plan going so that we are aware if they have allergies or asthma or other things that could be causing those symptoms. but we are calling and having kids go home and encouraging them to get tested and encouraging them to go meet with their doctor. And that's worked pretty well for us so far.
There was another question here about children remaining with the same teacher, and what I can say across the county for that is districts are doing their best to staff their classrooms, but just as when we might have to create a new classroom because of growth or declining enrollment, the staffing is not a guarantee. So it can change. So would and that's true at the higher ed level as well. I know when we had classes increase, sometimes the sections were split. Any of the K-12 individuals want to comment on that? Because I saw that come up a couple times about staying with the same teacher. Kurt, go ahead.
Just that's an impossibility, obviously, if you're not in a situation where the teacher teaches both in person and virtual, as Eric described earlier. If you make a family decision that's different than the staff member made, then it can't be matched. And we have to sort that out. That's what I was talking about earlier when I said parents want to know for sure, and we can't tell them for sure because we don't know for sure. So we do the best we can, but it just ends up, it depends.
And Kurt, I'd like to echo that. We're at the beginning stages of this for our district, and I know this will be a significant challenge. Mainly, what I will say is up and down the state of California, those districts that are bringing schools, reopening schools and doing a similar sort of hybrid, they're experiencing the same problems. Up and down the state, it's the number one issue that I see when I read feedback from the community. This is what I see. And it's just one of those horrible realities, consequences of trying to do this and give parents options. So when you give parents options to stay in distance learning or, excuse me, or come back, then what happens is you also have to do a matching of employees that would prefer to be in distance learning, but they'll come back if they have to, but they would prefer to be in distance learning. And so sometimes the numbers match up, sometimes it works, but for the most part, we're expecting there to be, just by looking up and down the county and the state, it appears that about 50% of the families are choosing distance learning. So that is a dramatic impact on staffing and on the underlying theme of that question is how in the world can you keep continuity with your child's teacher and offer these options to families? And this is the hard reality of this.
Yeah, I think jumping in there, I think those are some great comments. And parents, this is really an opportunity for you to be understanding and supportive. We do have staff members, and in this case, teachers, and they may have real qualifying needs, and they need to be able to work remotely. And I want to thank the parents in this county, specifically in Atascadero, for understanding that we've all got to work together on the best solution to benefit your children, and also to make sure we're doing the right thing by all of our school-based employees.
There was a question also about families remaining in the same cohort. And I know I've heard the discussions about districts trying to keep them there. Would anyone like to take that one on? Again, I know it's not perfect and can't be done every time, but trying to keep families on at least the same in-person schedule or distance schedule.
Yeah, Jim, that's part of what we're trying to accomplish with our declaration form, that while we have this AM and PM option, and then parents want to know that, am I going to be assigned to the AM or the PM? And to make things easy, in order to kind of break it out, we think, okay, we'll try and do A through L, M through Z, so alphabetical. But that comes with a giant caveat, and the caveat is the family cohort. So I have a student at middle school and elementary school, and what if they're in different cohorts? Well, I need to try my best as a team. We need to try our best to coordinate those things. So alphabetical is a place to start. It's not where it's going to end up. So because of the very things that you mentioned, trying our best to coordinate, to accommodate to the best of our abilities.
Thank you. There was a question about potential for one site to open full or potential for countywide school. Because of our 4,000 square miles across the county, I'm not seeing other than the 3 charters that we have, which accept students from across the county. Grizzly sort of is an outlier there. I'm not seeing that. I know the schools, districts, and the individual sites are trying their best to accommodate you, but I'm not seeing anything on that front at this point. Did anyone else want to add to that? I know that those of you that have multiple school sites in your districts will accommodate families to the best of your ability. Yeah. Okay. There was a follow-up question more for you, Dr. Bornstein, about grandparent with underlying health issues, recommended doing in-person versus at school. And I think you answered that, but if you want to add more to it.
Yeah, I tried to address that as fully as possible.
Okay, another question here. If school districts are providing transportation, can we talk a little bit about that? Is there a requirement to keep cohorts together, or is the requirement to notify families if the cohorts are mixed on the bus? So maybe a few of you that have busing could describe at least what's going on at this point. Okay, nobody wants to take that one on.
I know, I can say in our district, and I think this might be the same in others, we are only running buses for children with transportation in their IEPs at this point. And if a student, we have had a student being transported that was positive for COVID, we worked with Dr. Bornstein. They are maintaining the 6-foot social distancing. They are wearing their masks. The windows are open. And we decided we did not need to quarantine students riding the bus. That would probably be a different case if you had the bus packed and not able to allow that 6-foot social distancing.
Jim, if I could add, in Paso Robles, we are only doing mandated busing so far. We would love to be able to run buses out to Heritage Ranch, to the high school students out at the lake, and to San Miguel, but we do not have any drivers. We had several drivers retire. We have several drivers who are at risk, and we simply do not have drivers. So if anybody listening really wants to have bus transportation to Lake Nacimiento and San Miguel and Paso Robles schools, please apply to be a bus driver or find somebody who will, and we'll work it out from there. But as of now, we can't do it because we don't have drivers.
And I'd like to just mention the elephant in the room with transportation is that in our district, we have over 2,500 students in normal times riding our buses each day. And we have in our district, I know it's not as high as in others, but we have upward almost close to 40% free and reduced families that really, really need access through transportation to get to school. And this is for working families and for single parents who live beyond walking distance to schools. This is a gut punch to those families. And I really, really am looking for solutions. When you do look at the CDE requirements, and you look at the way in which they recommend you put kids on a bus, you're looking at maybe 14 kids on a 84 passenger bus. And so it becomes also a practical impediment. Not just do we have enough bus drivers, but is it practical when you have 2,400 kids that need a ride to school, and you really, at best, can support your special needs students, maybe your foster homeless youth. And what we're trying to figure out is how can we be creative, and Dr. Bornstein has been fantastic, by the way, at County Public Health and helping us try to brainstorm solutions. But this is one of those things that under the current guidelines, until those are changed, until those are resolved, I don't see a fix. And it's really devastating to many of our families.
One of the next questions was on scheduling and flexibility, and I think K-12 and also higher ed in this one. I know we are asking families to make decisions about a type of program, but could a couple of you superintendents comment on if situations change for their family and the flexibility that you would afford?
Yeah, I can jump in on that. And we've had that question in Atascadero Unified. And so the way that we're framing it is on the in-person side of the house, we're aiming to have that reduced class size with a stable cohort. And so with that starts to come some limitations that could minimize some of that flexibility. But if that space is there, then that choice would be available. And in that instance, a person would be transitioning from distance learning into an appropriate in-person classroom where there is available space to still capture that reduced class size and ensure that physical distancing. There is, however, I believe, greater flexibility when parents want to move back from in-person to distance learning. And that's something that we're absolutely open to that discussion. Yes, the distance learning classroom is critical too. We need to be mindful of class size so that those students also have that educational attention they deserve. But there's a little more flexibility that way. Hope that helps a little bit.
Thank you. Kurt?
But yeah, just one added comment. We are going to try to be as flexible as we possibly can. We told the parents that opted for homeschool at the beginning of the year that they could be guaranteed they'd keep their same teacher and everything for the whole year. But back and forth between distance learning and hybrid, we understand that circumstances can change. You can lose your job and suddenly you can provide childcare at home before you weren't, or vice versa. So we'd really like to do that. One little aside though, we are having to reserve spots in hybrid and in person for the parents who haven't made up their mind yet. And the sooner that parents can go ahead, and I know it's sometimes unlimited information, but go ahead and let us know, then we can open up that spot in in-person hybrid that we otherwise have been reserving.
Thank you. And at the community college and at Cal Poly, if student needs are changing because of COVID, what flexibility is being afforded to them as either far as registration or other things?
So we are, the fall quarter, we are at about 12, 13% in-person classes for our students and our faculty. We did not force anyone into an in-person situation. So our courses are mainly the lab courses. And so we have told students, if you're vulnerable or for whatever reason you cannot, be here, then we will provide a fully virtual course offering for you. And we've been able to accommodate our faculty as well.
President Stearns?
I would say our situation is similar. We have allowed students to make a choice, an informed choice at registration. So our schedule has lots of information in it around especially those classes that do have some in-person requirement so that students know what the expectation is. And again, we're roughly at 8% of our classes being offered do have a on-campus component, and we're going to be doing the same for spring. And so we are not moving anyone from one modality to another. Our faculty have been incredibly flexible and generous with students, especially those students that do have a class with a on-campus component, allowing students who either are not feeling well, have a child who isn't well, may have been exposed, second and third-hand exposure, really allowing flexibility for those students to work from home as need be. And so in some cases, really teaching a course in a blended modality that's very new for them. So.
Thank you. This next question was about reopening again, Dr. Bornstein. If our special education, our students with special needs have started at a school, is that school started or opened? Can the rest of the children start school at the location? My understanding was that it was grade level starting, not necessarily small cohort starting, correct?
Yeah, I'd like to be as flexible as we can in terms of the consideration of what constitutes a school having begun the opening process, but I think that they would have had to have an approved district plan for reopening, and at least brought back some students, even if it's just the orientation process, to consider that as part of the opening process. The special ed students and other groups that are on the school campus are doing so through cohorts.
Thank you. The next question was on sports, and I do know that I was listening to the governor's briefing today, and the CIF, which is the interscholastic group for our county, for parents on the line, is going to be working with us. At this point, our agencies are doing conditioning, but would any of the secondary schools, and I know Dr. Stearns, you've already started some sports with your campus, but maybe one of our K-12, our high school districts could just comment on the status of sports at this point.
If permitted, schedule start in January, I believe.
That's my understanding, and that's what CIF has announced. Although it's a moving target, it has changed a few times already.
Yeah, and CIF did announce today that there's no competition until they issue new guidance. So they didn't really give us a date certain at this point.
And for the post-secondary level, Dr. Stearns, I know you've had some starts and stops with sports.
So we had 2 different sports teams that we suspended for 14 days, one because of a small outbreak on the team of positive cases, and the other, the student athletes self-disclosed that they had attended an unmasked event at Halloween. And while none of those students have been positive, we just suspended them from in-person meetings for 14 days. So both of those programs resume on Wednesday of this week.
Thank you. I'm noticing there's a question here about the mask wearing, and Dr. Bornstein, you may have already responded to that, but best practice for reminding adults, college students. I can just say that in the workplace here, if someone hasn't, I've asked them to put their mask on and follow the protocols and procedures. We keep saying, hands, face, space, hands, face, space, take care of those things. I'm not sure whether that question was directed for in the public or in the markets there, but my advice, if anyone else wants to jump in too, just be as direct and as polite and professional as possible.
Yeah, I hear a lot about from people who say they have a medical exemption and that they are feeling discriminated against. How I advise people in that situation is to try, I know some people don't feel that they shouldn't have to get any kind of medical notation on this, but we do that for many other things in our systems, in employment settings, where you don't have to disclose the particular diagnosis, if you will, but it's not unreasonable for a school setting to know that someone has a medically sanctioned exemption, and to allow that person to be, fall under the state rules, which say if you've got exemptions, and it can be, a mental health condition, it can be a physical health condition, it can be a developmental condition, and we all need to be aware that there is going to be some proportion of our population that fall into that category, and just, it's no one else's business to take issue with them. But at the same time, I think it's also not unreasonable for a business sector or a school organization to require some type of validation, because there are places that we are aware where 90% have stated a medical condition, and that's just not reality based.
Thank you. There was a question here about lunches being provided to students, and I know we have varying plans across the county of grab and go, of food before and after. Would either of the superintendents like to comment on that? It wasn't specific to an agency, but I know you're all doing something.
Grab and go only.
And our young students, our kindergarten, so for this person who's responding here, we're providing lunches and meals to all of the students. It's not any specific. As long as they're our students in our schools, we're doing our best to provide services for them. And Eric, did you want to comment on that?
Yeah, we're fortunate, as many of you are. I mean, our food services program is pretty remarkable. I think we've fed close to 400,000 meals since March. I mean, it's pretty remarkable. What we're doing now is a combination of right now it's you pick up a week's worth of meals at one time. If we go to the hybrid AM/PM, then there'll be grab and go for breakfast and lunch, and and then we're working on breakfast, lunch, and dinner in one particular pickup time frame for each of the cohort groups.
Thank you. This question was a San Luis Coastal one here, and if I'm reading it correctly, how likely would it be in Coastal for schools to open during Purple that have started a pilot? I mean, my understanding, Dr. Prater, is that your plans are to move forward in January. However, if our health conditions change, that might change as well.
Yeah, so I was just trying to respond to that question, actually. I'm sorry, I was a little distracted. What I will say on that is my recommendation to the board tomorrow is anchored to reopening in the hybrid based on being in the red tier and 14 days minimum in the red tier. And in terms of reopening or applying for a waiver in the purple tier, we just have not pursued that as a strategy. We have worked within the purple tier along the guidelines with County Public Health to do small cohorts. And so that's where we've been able to do the preschool TK and now the pilot kindergarten. But that's based on teachers being willing to volunteer. So those, to go ahead and do those pilots. So for us to reopen in full, it would require a red tier or better, unless something else comes up that convinces me otherwise. I think in purple tier, we'll stay with the cohort model in small groups. So in kindergarten, we've created a pilot with small groups that align to the purple tier requirements. So So that might be something we pursue moving forward.
Thank you. The next question I'm seeing here was about testing of staff members. At this point, all of the school staff throughout the county, which is somewhere around 6,000 people, are being tested 50% per month, which is what the state is recommending. So that question was broader testing. So I'm not sure that's school specific here, but all of our employees are now moving forward, and that includes the higher ed as well. So did you want to take a stab at that one, Dr. Bornstein? I think getting 50% tested per month is a pretty high number right now.
Yeah, that is, and actually, I think the way the guidance reads is 25% every 2 weeks. And the reason to make that distinction is so that you've got, you wouldn't want to test everybody once every 2 months. That, you want to provide some view into what the prevalence is, what's happening amongst your staff on an ongoing basis. There's a lot of dialogue amongst scientists about whether what level of value there is at even this level of testing as opposed to something more frequent. As testing becomes easier and more available and quick, I hope that we would be able to see even more expanded testing opportunities, that's not uncomfortable, sorry. And it has rapid turnaround so that it can be used and happen on a more regular basis. But right now, that's where things are at, is 25% of all staff every 2 weeks.
Thank you. I'm looking at some of the other questions here. There's quite a few that are specific to Lucia Mar, and I would encourage people to ask them directly. I don't know the status of Lucia Mar's waiver for its elementary campuses, and I would direct that question to Lucia Mar School District. I know they have a board meeting tomorrow. There's some questions about arts programs, band, choir. Kimberly, you've had classes in probably the longest of all of us. Are you seeing that? And then Jill, I know that you also have come up with some unique ways for some of those classes. Would either of you want to comment on some of the successes you've seen with that and not just the challenges?
Yes, for our music classes, we do have some limited singing if it occurs outside and the students still have masks on and they're socially distanced well over 6 feet. We aren't engaging with wind instruments at the moment, but I know that our high school program, they did have a music class through their distance learning program, and the students were learning how to play the ukulele. So I think, we've gotten creative with how we are offering music to our students, and it's been well received.
And Jill, were you telling me about some of the fittings that are on instruments and such for some of those classes?
So our choirs actually have singing masks, which are very strange, but are working for them. And they also are outdoors, and they are greatly distanced from one another. In addition, we do have some woodwind and brass, and they also are outdoors only, very well distanced as well. And our drama is all via Zoom at this point in time, so they are not having any face-to-face. So we are being creative. Of course, if it becomes wet and cool, it is going to be a challenge.
Thank you. Anyone else want to comment on those classes? I know they've been a challenge, and I get lots of questions on that. Okay, I'm going down. There have been a couple of questions here about inspections in districts, and I just wanted to comment on that one. Each local jurisdiction has a governing agency that oversees it, whether it's the Diocese of Monterey, whether it's San Luis Coastal School District or Questa College Board. And our office works with those agencies, but I want to remind everyone that each locally elected governing agency or appointed agency has the authority. The only person who can trump everyone, and it's in the backwards direction, is Dr. Bornstein. From a health department, she can move us backwards, but neither her office nor my office can forcefully accelerate an agency. Those are local governing decisions made by the local agencies. Would either of the superintendents like to just comment on that? Because there is some misperception that and we're so different across the county. Okay, I guess they're comfortable with my response on that one there. As far as concerns or complaints are going, I know the county has a hotline, because there was the question about that, about enforcement or looking at those. And anything you'd like to comment on that one, Dr. Bornstein?
No, I wish I had the number handy, but you can get any information on readyslow.org. There are varying phone numbers there for, regarding testing, but also the compliance line related to enforcement is available there.
And just also to respond to that one question on compliance, when I'm hearing from an agency that there's a concern, it's shared directly with that agency head. So if it is a school district or I know we had a conversation with one of the other alternative schools in the county, and myself and Dr. Bornstein actually spoke with that director regarding what they want to do for a graduation ceremony. And it did get political. I don't want to kid people, because one of the parents was another elected official, and they wanted to do something that wasn't permissible, and we just said, this is what we see, this is where we can go, and again, trying to be respectful and honest with those individuals. So if something is brought to our attention, we will discuss it openly and honestly with those agency heads. Did you see that question there, Dr. Bornstein? You want to say any more on that?
Yeah, no, I didn't actually see. I've stopped reading the questions and counting on you to relay them, because I found myself not being able to be in two places at once. But what I can say to your point is, yes, if we get through our compliance or enforcement line questions related to school districts, it's not going to go the same way as it would with another business, where we might send environmental health or our code enforcement folks in planning. And if there are issues of concern related to a school, it's very much going to engage the school leadership of whatever district or individual school is involved. I hope that additionally helps.
Right, and just to reassure people that everyone involved this evening, that's a school leader, an agency leader, takes this seriously and is trying their best to inform their workforce and their families. I know I've had to remind employees and have had to constantly send out notification about, here are the practices we expect you to follow. So anyone else want to comment on that one? Because we do have differing opinions among not only our families, but our employees. Okay, we're running to the tail end here. I'm trying to scroll through some of the questions. If they didn't get answered this evening, I will do my best to get them off to the local agency. Again, Lucia Marr questions, please direct those to Lucia Marr. All of the school districts are having their meetings, are being broadcasted, we welcome. I know San Luis Coastal's had over 1,000 people engage recently with their districts. Would any of you else like to say something before we close for the evening, and just again inviting people back to ask questions and speak to us directly? We're here to serve the best we can.
So I just want to give one specific point of information on the CMR, because we have been very transparent about through the media which school districts we have received waiver applications from. Once they're approved, they get posted on our website. So I can say that we have not received a elementary school waiver request from the CMR at this point in time. They're not here to represent where they are thinking about the possibility of doing so, but at this point in time, we don't have one.
So any closing comments from any of the panelists this evening? I just thank you all for being here, and thank you to the community for being patient with us right now. We're moving through this together, and we are trying our best to serve our children and their families.
Yes, I just want to thank you, Dr. Brescia. Your leadership has been invaluable in this. There are, 14 different school entities in the public sector and about 20 in the private sector, and having the ability to come together as a group to think through these things and to have common messaging has been really helpful for public health in working with the schools, and to help families who are sending questions in directions to schools and public health, that we can try to create coherent responses. As you said, this is not easy. This is not easy work in any stretch of the imagination, to try to accommodate all of the desires and needs of students, staff, administration. And really, I do think that everyone is trying their best to, with at the end of the day, the students as the primary audience for our best efforts to get them as much in-person education as absolutely possible. And we will continue to do that as we move forward.
No, I agree. Yes, thank you, everyone. We very much appreciate you being here this evening. And to the public that's listening, thank you for your patience. Continue to present questions and continue to engage with our local school districts. All of our meetings are open. These are meetings held in public for you to participate. Dr. Bornstein, thank you so much, and thank you to the county government for helping facilitate this evening. Kimberly, thank you to the Diocese of Monterey and your 16 schools, I think, that you represent in 4 counties. Amber, thank you for special ed. And Chelsea, thank you for serving as our legal counsel. Good night, everyone. I appreciate your time. Stay safe. Thank you.